Dr. Shonda Kelly is a board-certified oral and maxillofacial surgeon with nearly 20 years of experience in her field. Dr. Kelly's scope of practice includes sedation, anesthesia, dental implants, wisdom teeth and sleep disorder breathing, OSA, TMJ, oral facial pathology, trauma, and facial cosmetics. A native Floridian to Central Florida, Dr. Kelly recently returned home to the Sunshine State, where she opened her own practice to serve patients in Central Florida.
I was down, but now I'm up. Yeah.
You're tuned into the EG Dominates Dental podcast. Today we are at the office Surgical and Sleep Solutions in Orange City. Dr. Shonda Kelly, welcome to the show.
Hey man, how are you?
Doing really, really good. How are you?
I'm great. Good to be here.
I'm so glad you're decided to come onto the podcast. I think you have an amazing story to tell. You're a doctor that I've known for a couple months. And I think that the fact that you're from Central Florida and the accomplishments and things that you've done over your years, I think you've got a great story to tell. And I know that you just recently opened this practice, and this is kind of a really good way to hopefully have some general dentists that are looking for your services for their patients be able to see you and kind of learn more about you as a person and as a doctor and a business owner.
Absolutely.
So the whole premise of the show is to really give you a platform and a way for prospective patients and other doctors in the community to get to know who you are. Want to turn it over to you and give you that platform. And I'd like to start out, I know you talked to me a little bit about being from Central Florida. So tell us, exactly like, where are you from? Where did you grow up?
So I grew up all over. Central Florida I consider my home. I graduated from high school from a small Christian school, Forest Lake Academy in Apopka, Florida. Prior to that, I lived in the Bahamas, where
Really?
my father's from. Yeah, I went to Bahamas Academy there. And, I had the privilege of living in multiple states prior to that. And it was just coming to Central Florida, felt like home. We settled here, became a part of the community, made some great friends, and just, always came back home. So
That's awesome. So grew up in Apopka?
I did.
Okay. Mm-hmm. And you get to the age where you're ready to graduate from high school. How did you decide to go to the University of Alabama when there's so many people in Florida that love Florida State or the University of Florida?
Yeah, well, first of all, Roll Tide. Alabama came to me. It was, I'll just be honest. It was, I feel like God wanted me to go there. And the opportunity just felt natural. It felt like the place I was supposed to be. I was close enough to Florida. It was a great school, first and foremost. Mm-hmm. And I really felt like I was going to get a great education there. So that's why I went.
That's cool. So did you have family in Alabama, or was this a journey that you made by yourself?
Yeah, I did actually. I had a few cousins there actually from the Bahamas that had moved there years ago. And so I had a little bit of a support system there. So I landed in Huntsville, Alabama. It was my first step out back in 96. Went to Huntsville and I went to Oakwood University. I graduated in 2001 with my bachelor's in biology. And being right there in Alabama, I was, close to Birmingham. A recruiter came up and talked to us about how great dentistry is and the creativity that you can get to have, the science that you get to learn, the patients you get to treat, the ownership that you can have, the diversity of the field. And I just felt like it was right for me.
That's awesome. So you kind of started thinking about dentistry when you were a senior in undergrad or before that?
Actually, I started thinking about it when I was about a junior in undergrad. It really fell in my lap. It's a very personal story, so I'll let you know. Easter Sunday, when I was a junior in college, we had a big alumni weekend at our university, which is a tradition for us annually. And my dad came and we had breakfast and we parted ways, and he went down the road and unfortunately was killed in a car accident. Prior to our departure, he said, Shonda, when I came to this country, I wanted to be a dentist. And I was like, come on, Dad, nah, I can't work anybody's mouth. Like, no way. But I just went on. We went into the next semester. And then a recruiter came to my college and he looked like my dad. And we were all sitting down in the science club and he said, you know what? Dentistry is this great field. These are all the reasons you should go into dentistry. So I said, okay, I'm going to do it. I was kind of lost my direction in life. I didn't really know where I wanted to go anymore. And I took the DAT, which is the dental admissions test, the examination you take to get admitted to dental school, much like a GRE or an MCAT to get into medical school. And I studied for 30 days. I took the test and got a pretty good score. I applied to several dental schools, and Alabama was one of the ones that accepted me. Even that story, when I went to visit Alabama, if I can tell you real quick, I actually had an interview at another school. So Alabama called me up and they said, hey, come to your interview tomorrow. And I'm like, or maybe it was like next week, it was pretty quick. And I said, hey, I can't go. I've got a prior commitment. And it turned out that they had to meet again. So they met again and they called me up again. They said, hey, we really want to take a look at you. So I said, okay, I'm going to go ahead and come down. Normally, after you do an interview at a dental school or a medical school, you have to wait to get your letter in the mail, and you're checking the mail every day. Hey, am I getting in? It's kind of like really like you're
pins
anxious.
And needles, waiting to see.
Yes. And so I did my interview. I had a tour. So the dean said, hey, let's just go walk around and see the rest of the campus. So I did that. And before I walked out, right after my interview, about 2 hours later, they handed me an envelope. And that envelope was my admission to University of Alabama with a scholarship attached to it. So I said, I think this is meant to be. So
that's incredible. That's awesome.
So,
that's unique.
Yeah. So God led me there. I know where I'm supposed to be in life. I feel like this is a part of my journey. And, I just also feel blessed that those doors opened for me when they did.
That's awesome. So take me through, you start dental school and, some of your accolades. You've got a ton of awesome recognition and things that, that you've strived for, that you've accomplished, in your career. Tell me about your experiences as the chief of residence, right?
Actually, I was a chief of Oral and Maxillofacial Surgery at the VA Medical Center in Birmingham.
Okay, so talk to me about that.
Yeah, that was an amazing experience. I worked there and dedicated 11 years of service. And I started that position really right after I graduated from residency. And that was also in conjunction with being an assistant professor with the University of Alabama. So basically, I just joined my faculty as a faculty member of the school that I graduated from and the residency that I graduated from. And I just really became a teacher on that side of things. I had a time where I had a promotion where I actually was the chief of the dental service, where I was in charge of all of the divisions of dental for a while when need came. And so that really gave me great administrative experience and prepared me for where I am today. And so, yeah, it was a great experience. I got to treat veterans of, I actually was lucky enough to treat a veteran from World War I before, they all passed.
Kidding.
It was amazing.
Wow.
I've met 99-year-old veterans, and just for them to come in and for me to hear their stories, I've seen some pictures and of their time either in Vietnam or Korea or Afghanistan. It's just been a privilege to serve people that kind of help us have the privileges that we have in our country. And so it just has given me a lot of pride to be a part. That was like my first basically 10 years of my experience in practice as a provider. And so I felt that prepared me to come out because I did a variety of procedures. I've practiced the full scope of my specialty, and even today I'm a provider in the community for veterans because it's just in my heart. It's a passion of mine.
Man, that's awesome. That's great. I'm glad that you are sharing that stuff with us because one of the things that drew me to you was, number one, I felt how in a short period of time I felt a connection to you. Like, you're a very compassionate person and you've got main character energy. And when you combine those two, right, like, people want to gravitate towards you. So that's incredible. So tell me, like, you become a dentist and you didn't practice just as a general dentist before you decided that you wanted to become an oral surgeon. Like, how did you, at what point did you decide I want to go from being a general dentist to going above and going back to school and becoming an oral surgeon?
Yeah, good question. So, like, I was always a go-getter, right? So, and being like West Caribbean, West Indian descent, we always have like one or two jobs.
Okay.
So in dental school, we were doing.
What were your jobs?
So I was a dental assistant.
Okay, so you're going to school and you're dental assistant.
I was going to school, so I was a dental assistant on the weekends with one of the residents who was at the time an oral surgery resident. He said, hey, I'm looking for an assistant to come help me on the weekends. So listen, the back then the struggle was real. So
You're like, I'm doing it.
I'm doing it. I'm
need to make
in.
money.
It was the best $100 I made in a day.
It's the experience.
Yes, it was the experience. And I got exposed to basically dental alveolar surgery, taking out wisdom teeth, office-based surgery. And he was an amazing surgeon, still good friend to this day. And I said, you know what, I'm interested in this. And he's like, oh yeah, well, if you're interested, you need to come to the operating room with us. And then once I went to the operating room, I was hooked. I was like, this is for me. So
tell us, like, give us the scope of different procedures that you do here in the practice. Like if I'm a patient and I'm wondering, like, well, what exactly does an oral surgeon do?
Yeah, good question. So we have different, let's just call it divisions of our specialty. And so one of the main things that oral surgeons do is to provide surgery for your mouth, inside your mouth. You can think of it surgery inside the mouth and surgery outside the mouth and in the face. And so we are basically doctors of the face, whether you, let's say, for example, have a trauma and you get a car accident. Okay, you break your jaw or you break your orbit, your eye socket, or your cheek or your nose. We're able to take you to the operating room and fix the bones of your face. That's our trauma area.
Okay.
The other area, second area we do is in the office-based procedures, where if you lose a tooth for whatever reason, or you have some gum disease and teeth need to be removed, we take the teeth out. We put in dental implants to help restore your function so you can chew again with stability and not have, a denture that's falling out or not fitting well or causing sore gums. Or if you need your wisdom teeth out, for example. And then sometimes you need little lumps and bumps, let's call it that.
Okay.
You get inside your mouth, or a swelling. So we can take a biopsy of that and find out what it is and help guide you to, just getting those sorts of things cleared up. And so that's kind of our inside the mouth surgery. The most really important thing I think that we provide is that we're able to do it in a manner to keep you comfortable and to have the best patient experience, because we are the only surgical specialty as oral surgeons that are trained in anesthesia by anesthesiologists in our residency training. So all of us do our own anesthesia. That's our choice. Some of us bring other providers in, but
Sure.
we can do our own anesthesia in office. Or our patients that are scared, that really are afraid or have had a bad experience from their childhood, they're able to come to us, and we're able to do sedations in a safe environment that they can, have their procedure done and just really not have that fear that they're going to be hurt and that they're going to, have a bad experience.
So here's one thing I think about quite often from a patient perspective is I think that people are naturally generally scared to go to the dentist,
Yeah.
right? And I think that there's a high amount of anxiety from a patient's perspective, and patients nowadays are savvy, right? We have more resources than ever before,
Right.
to do our research on doctors, or if a doctor refers us to a specialist. And I think that emotional connection is something that is in high regard from a patient's perspective when they're looking for a provider. The second thing is, what is that patient experience going to look like? So that's something that I talk about all the time, talk about it on every single episode,
Yeah.
is what in your mind do you want that patient experience to look like for somebody that's coming here from the minute they walk through the door?
Yeah, so great question. And that's really one of my passions, is like, I want the patient to understand that I feel and I think about them as if I were them, or if they were one of my family members. I want their experience to be warm and inviting and comfortable and open, so that they're able to share their concerns with me, their why. Why are you here? What do you need? How can I make your quality of life better? I want that patient to be able to know I'm here to solve the problem that you're having in your life, if I can, and offer that in the safest manner that I can, with the best technology, with the experience that I have and expertise to deliver the service to them.
That's awesome. So at what point through your journey did you decide it's time to move back to Florida?
Well, the easy answer to that is COVID.
Okay.
The family answer to that is that, my mom was getting a little bit older. Kids came. I've got a 9-year-old, an 8-year-old, and a 4-year-old. So needing some help with the family. And just really, realizing that, I don't think we were meant to do the same thing our entire life. Like we can kind of move and shift in different facets of our own careers and our own fields that we have. And so, I felt like after giving a decade of my time to the veterans in the VA, I felt like it was time just to go on to the next phase and go into private practice and take the skills that I had learned and honed there and bring them out into the community, because there's just so many other people that need help and that don't have access to care. And so, the community that I chose, I felt really needed a good oral surgeon, and maybe it chose me too, but that's why I decided it was time.
So we're in Orange City. If you're not familiar with where Orange City is, in relation to downtown Orlando, we're about 45 minutes
if
north?
that. Yeah, okay. I'd say, yeah.
So pretty
to the west.
Pretty conveniently located, to a lot of places within Orlando and the surrounding communities.
Yeah, I mean, you get on the new expressway that they built, the
429 or which one, the 417?
No, right through I-4. They built
Oh yeah, yes.
The little quick hop on expressway.
I haven't been on that one yet.
Yeah, I get here in 30 minutes. So
okay,
yeah,
so fast.
Yeah. I take it every day.
That's awesome.
Yeah.
So, open the practice in December, and how are things going so far?
Great.
Yeah.
We feel really blessed to be here. We've gotten a lot of support from my colleagues in the community. People have reached out to us. A lot of older patients that were here from the practice before, they've come back. People are just glad to know that they can get into a surgeon within a reasonable period of time, and they can come here and just have a friendly staff, a staff that's educated and knowledgeable about their needs, of being able to answer their questions. And so, the reception here has just been phenomenal.
How hard has it been going from working as a doctor at the university to transitioning to now being a full-time doctor and a full-time business owner? Because this is the first time that you've actually owned your practice, and so you're heavily involved in all of the business side of things, but also too you've got a very aggressive schedule with consultations and cases and things like that. So give me tell us what's been some of the things that you've learned from this process.
Yeah, I mean, it's been crazy fun. I mean, it's been a lot of work. I mean, honestly, you have to work in the business as the doctor. You have to work on the business, right? Yeah. And still balance your work-life balance with your family and your kids. And some of the things I've learned have just really been, that people are people, and that for me to deliver the services that I need, I have to do it in an affordable manner. And I have to still have that personal touch with my patients, which I do very easily because that's just who I am. I'm naturally a warm and very caring person. That's why I went into the medical field. And just setting schedules and accommodating to the needs of the community, the referring doctors and what they need, because I have two customers. I have my referring doctors are my customers, and then I also have my customers who are my patients. And I want my referring doctors to know, and I want my patients to know, that I'm going to treat you just like you are at your home office where you came from. This practice is an extension of the practice that you're coming from. And I always strive to be able to deliver the best in care that I can every time.
That's incredible. What are you doing right now as far as coaching and developing your staff? Because I know anytime, you're opening a practice and you're hiring people and you've got a great group of folks. But given the background that you have with education, what are some of the things that you're doing with your team?
Super blessed. So I'm an educator at heart. I mean, you start out your career doing that. I'm always like saying, hey, come over here, look at this on this x-ray, or hey, let me ask you why. Do you know what this medication's for? And I've got a staff who they go to Google. They walk around with their phones like, hey, doc's going to ask us this, because I can deliver better care. The stronger my team is around me, the better care I can deliver, the faster I can deliver it. And the more comfortable and confident my patients feel about my practice. Some of the things we've done so far, we just got back from Portugal last week. We went to the world-renowned famous Mallow Clinic, where we got a refresher course in zygoma placement, pterygoid placement of all-on-4 concept implants.
No kidding, in Portugal?
In Portugal, in Lisbon.
Wow,
it was an amazing
incredible
trip. Yeah, and we've been to I take my staff to other courses. I support them in getting anesthesia certificates and training through our national organization, American Association of Oral and Maxillofacial Surgeons. Again, I want my staff members to be able to get current knowledge and education in the field, the same knowledge and education that I'm getting. Secondly, I also choose staff members who have a background of education, who are either, if they don't have the years of experience, but at least they have some, higher level educational training.
That's awesome. That's great. I think that anytime you can find people that have a good heart, good attitude, and good work ethic, and you're an educator, it makes things a lot easier to be able to develop people and, help them along, progress along their career.
You have to be willing, you don't have to have all the knowledge, but if you're willing to learn and you have the energy and the enthusiasm for just being hungry for knowledge, I think that's the most important thing. I want people that want to learn and always want to strive for more and always want to be better. Like the sky's the limit, and it doesn't have to be a saying. You can live that every day in different scenarios and in different ways.
So tell us a little something that maybe not a lot of people know about yourself.
I was the first African-American female to be accepted at the University of Alabama in Oral Maxillofacial Surgery.
Congratulations.
Thank you.
Wow.
What a privilege,
That
right?
is incredible.
Yeah. So, again, chosen, some people could say right place, right time, but I don't feel that way. I feel I was chosen. I feel like it was the path that, I was put here to be and here to do. And, I'm thankful to my professors, my mentors, Dr. Peter Waite and Patrick Lewis, who brought me into the program and who, cultivated me and, gave me the opportunity and, hopefully I made them proud.
That's great. So full-time business owner, full-time doctor, full-time coach and mentor, full-time mom, full-time wife. Take a pause and, right?
Yeah.
When you do have free time, what are some things that you enjoy doing?
Sleep.
Yeah?
I do enjoy traveling. I enjoy spending time with my kids, Summer's packed. We're headed to Bermuda next month. Then the following month, we're headed to Colombia. Just got back from Portugal. I just enjoy spending quality time with them because I know they're going to grow up fast. So that's a big priority of me right now, just being a mom and, being present where I'm at, no matter what situation you're in. I think just taking the best out of it by, number one, learning just to be present where you are. Mm-hmm. And I think, that's something that, I've learned over time.
That's awesome. Okay, so last take.
Okay.
Last take. You got the final segment to tell us anything extra that we haven't discussed already about yourself, about your practice, about who you are as a person. Go for it.
I just, I just want people to know that, they can come to me with whatever fear, anxiety, whatever concern that they have, and that, hopefully you can find a connection with me, with my office and with what I do, and know that I'm here for service, for service to mankind. I was brought up going to mission trips and doing that at a young age, and just being there for people in whatever way I can. Sometimes it's not always as a doctor. Sometimes it's emotionally. Sometimes it's for reassurance. Sometimes we don't do anything at all. But then there are other times that we do. And so I think just knowing that, I have an open spirit and, just a person of integrity, fun, just, here to just make the best out of life. And,
there's been a huge rise in technology in the dental industry in the last couple of years. And you really see it on every single level, not only in a general dentist office, but also in specialty offices as well. Mm-hmm. What have you found as far as an oral surgeon? What are some of the technologies that have come out recently that you've adopted or incorporated into your practice? Or what are some things that, that you are providing to your patients that, enhances that experience?
Yeah. So, technology is amazing. I want to keep myself cutting edge, being able to use the advances in technology that are proven to work, right? And that are worth investing in to be able to deliver really the same type of care, but in a more effective manner that the patients don't have. Let's say, for example, you don't have to have as much pain or swelling because it allows me to deliver a service with less invasiveness. Okay.
Sure.
So I use 3D printers here. I use 3D scanners facial scanners and 3D CAT scan. I also have a 3D intraoral scanner that we use, and we use these devices to capture data. Data is really what technology is all about, and what do you do with that data? So we take that data and we work with advanced laboratories to combine, and other planners, other technologically trained engineers to help us be able to deliver surgical guides for implants.
Yes.
So that we can put implants in precise locations, much like navigation, which is another technology that's very popular in the dental field right now.
Yeah.
And so I think the precision, I want to be able to deliver that when I put in an implant, or if I'm planning a case or looking for pathology or a lesion. I want to be able to have clarity in looking at 3D reconstructions of the airway. That's another example of how I use my CAT scan to look at any areas of concern that comes in.
It's crazy. I wonder what technology is going to look like in, say, 10 years from now.
Oh my God. I don't even know if we know all the jobs that are going to be created from what's going to be out there in 10 years from now. Like, it's going to be a whole new dynamic, and you just have to really keep yourself educated in what's going on and the development of it. So
And
that
AI.
and AI as well. Yeah. So that's another area that, has a place in medicine, but we have to be really careful about it, because also security is a big concern.
Sure.
We have to keep our patients' information secure, our practices secure, and cyber attacks they're out there, they're real.
Yeah.
So we have to, really be careful of where our information is stored. And so that's another area. Again, being a business owner, oh my gosh, you just learn so much.
Yeah. How many hours of sleep are you getting a night?
Ooh, depends on the night.
Yeah, it's definitely a lot.
Yeah.
So I'm really curious, how did you come up with the name for your practice? So you're oral surgeon, oral facial maxillary, and you got surgical and sleep solutions. So tell us about that.
Yeah, so remember you asked earlier about what are all the things an oral surgeon can do.
Yeah.
Well, one of the things we can do is we're a part of the sleep medicine team, and there's a specialty within dentistry called dental sleep medicine. And so I am not only a surgical provider of sleep surgery, so we do surgeries for patients who have obstructive sleep apnea, which is basically an obstructive sleep apnea is a condition where when you go to sleep at night, your airway is closing. Okay, you can have a full or a partial obstruction of your airway where airflow is not going from your mouth or your nose down to your lungs, and your tissue in your body is just not getting oxygen during the night. And so that can cause, over time, a lot of effects on the heart and the mind.
How common is this? What percent of people
it's
affected by this?
Over 50% of the population is huge. And so it's become a passion of mine, actually. And so that's why I named it Surgical and Sleep Solutions, because I treated a lot of patients with sleep apnea in the veteran population. And the need for sleep doctors and dental sleep medicine doctors is just tremendous. We don't have enough providers out there being able to provide oral devices, oral appliances for patients who cannot tolerate or which cannot use CPAP therapy. CPAP therapy is basically where you wear a mask at night and it blows air into your nose or your mouth, depending on the type of mask that you have to keep your airway open at night. And a lot of people can't tolerate it. And so we have to have another solution to be able to help people live healthier lives and not really to avoid some of the problems that sleep apnea can bring, which really are on the heart. And, so I do save lives every day. I save lives every day because I'm able to treat patients effectively with an oral appliance by advancing the mandible forward. So the oral appliance is a custom-made medical device to the teeth in your mouth, and we use that just as a rest. The teeth are as a rest to hold the device in place, which holds your jaw forward at night to open your airway, so you can get more restful sleep. You want to wake up in the morning, you want to feel restored. So if you have a lack of restorative sleep, that really can affect the way you think, mental fog, headaches, confusion, wanting to take naps all day, just feeling tired and fatigued. And that's just really you can't get work done. Sometimes you feel like you can't drive or you get too sleepy. So those are some of the symptoms that you can experience if you have untreated sleep apnea.
So what's the leading cause of this?
Well, it's different causes. It's more prevalent in certain patient populations, but Even as you get older into your 40s and 50s, we deposit fat in our necks as we get older.
Weight gain.
Weight gain, yeah, that's a big part of it. And then some syndromes can have it, some craniofacial abnormalities, which is basically the way that our bones in our face are formed. That can actually cause it as well. There's two types of sleep apnea. There's the obstructive sleep apnea and the central sleep apnea. It can come from your brain, where your brain just tells your body don't breathe, or it can just come from anatomically from the way you sleep, or when your tongue falls back and your airway closes. So that's the sleep apnea that we treat as oral and maxillofacial surgeons, and even as dental providers, to provide those appliances. It's covered by medical insurance, and we live in a community, again, where there's just not a lot of providers for this. So I feel like this is a passion of mine. I feel like it's a service I can deliver to the community, and it's very well received.
That's a great service.
Thank you.
Great service.
Yeah. Another service I provide is temporomandibular joint. Some people call it the TMJ.
Oh, yeah, TMJ.
Yeah, a lot of people, the TMJ is a joint, okay? Just like you have a knee or an elbow, okay? But you can have a lot of pain in your TMJ, and a lot of providers either aren't comfortable treating it or just don't. And so I am one of the providers who has developed a passion for treating TMJ because I've learned how to treat it effectively through a lot of continuing education courses, and just really through, again, my experience, having a lot of experience at the VA, where I've either done TMJ surgery, or I've been able to provide an appliance or a device for a patient to use in their mouth to help relieve a lot of the inflammation and the joint pain and the noises that they experience.
Yes.
Headaches, it's very difficult to live with just that chronic pain all the time. And so, that has been another area that I've developed myself in, and that I'm proud to be able to deliver that service to the community as well.
And that's why we love you.
Thank you.
That's why we love you.
It's kind of weird talking about yourself.
Well, look, I'm so glad that we had a chance to sit down and talk. Thank you for being on the show.
Thank you.
And I hope that a lot of people out there get a chance to listen to this episode and a chance to get to know Dr. Kelly, because she's absolutely fantastic. So thank you again for your time.
I appreciate it. It was my pleasure.
I was down, but now I'm up.